In the triangle position, widen your feet a little bit wider than shoulder width apart while still keeping the feet pointed straight ahead. So if you look down at your feet, the outer edge of your foot should be what's pointing forward. So why don't you slightly point the feet in a little bit? Perfect. From here, nice and slow, we're going to allow both knees to move to the ground to the left. And when they do this, your right pelvis is going to come up off the ground and the lower back's going to arch. Now, using both hips, bring your knees back up to the middle and now drop them down the opposite way to the floor to the right. Good. And using both hips again, come up to the middle. We're going to be doing this for about 2 to 3 minutes here, back and forth, nice and slow. Now, notice how when your knees drop down to the right hip has to externally rotate, the left hip has to internally rotate, and your pelvis naturally moves to help this happen. This is your hip and pelvic rhythm that should exist naturally. And that's what this exercise does. We are trying to move and rotate the hips and reestablish that the pelvis should also rotate with that. If there is an imbalance in how either one of your hips or how your pelvis, or lower back for this matter, rotates, you're going to notice that your experience moving to the left is different than your experience rotating to the right. So take your time and really scout out, how does it feel moving to the left versus how does it feel moving to the right? Range of motion's not important to me. What's important is that you find a comfortable way to do this. If you can, the direction that you're moving towards, that knee should be able to drop down to the ground, but only when we have really great hip function, so we don't need to force that. The hip that is internally rotating, so right now in this example, it's her right hip, that knee is never really going to go down to the ground. It's always going to have some space on it. So again, ground is not the objective. The objective is to resynchronize how the hips, pelvis, and spine move together. If you notice symptoms or discomfort moving to one side, then just stop just shy of before you feel those symptoms and treat the other side the same way. Meaning, if you've got symptoms moving to the left and you're limited moving to the left, but you can go to the right all the way down to the ground, I want both sides to match function. So if you can only go one way a couple inches, go the other way only a couple inches. And as we continue to do this exercise, make sure the feet aren't starting to creep and point outwards. So maybe on the next rep, bring your knees back up to the middle and just check to make sure that those feet are pointed straight. Great. And then begin the next rep. And the feet being straight ensures that we are not trying to rotate through the foot or the shin at all, which means rotation is only happening at the hip joint. And that's what we want, is for the hip, the pelvis, and the spine to rotate, not the shins and the feet to rotate with everything. Most people will find that if their hips, pelvis, and spine don't really rotate that well, that's why the foot starts pointing outwards, to help make up for the lack of movement happening up here. And because of the importance of this, that's why we're just going really slow, 1 rep at a time. Okay, that's about 3.5 minutes, which is pretty great for this exercise. If it feels good and you're getting great relief from this, please feel free to continue it. If not, let's move on to the next thing.